Hello, my name's Paul and I'm a patient under the care of the endocrine team at Christie Hospital. I imagine that if you're watching this video clip, it's either because you've recently been diagnosed as having a pituitary tumour or perhaps you just received some initial treatment for that. And if you're anything like me, or like I was at the time, I can imagine you might be quite anxious, you might be a little bit frightened, and you'll certainly be concerned to know what is going to happen to you and what is the best thing to do. Well, the good thing is that the team at Christie's are very, very experienced and very ready to help you in all matters relating to this. They'll always be there at the end of the telephone and they'll monitor your treatment plan just as they did mine. However, there are some things that you as a patient will have to do for yourself, because with a pituitary tumour, the follow-up treatment invariably means that you're going to be on a course of medication. And it could well be that this medication is going to have to be taken for the rest of your life. So you need to take ownership of it. Now, the way that I do that is, because I take a whole range of medication. I take hydrocortisone and thyroxine and Testosterone, and I have every day, or for 5 days each week, I have injections of growth hormone. And it can get a little bit confusing. So I've got one of these devices. This is just a simple book with compartments in it, and you can get these at most chemists. And it divides it into 7 days, and each day has got the tablets for the day, and it's marked into morning, midday and afternoon. Now, my wife actually puts these together for me, which she does every Sunday, and I'm very grateful that she does, because she does this every Sunday morning, and she also keeps a separate one of these as a backup, so she's always 1 week ahead. She then tells me what items I'm going to be running short of. And because I've got a very good GP who allows me to order medication online, or repeat prescriptions online, I then do that on the computer and can pick them up from the pharmacy sometime later in the week. However, this isn't foolproof. I mean, sometimes that my wife will say to me at 4 o'clock in the afternoon, you haven't taken your midday tablets yet, have you? Sometimes it might even be in the following morning. She tells me, you didn't take your tablets last night. So you have to be a little bit disciplined, and I try to. In fact, the evening ones are the ones I'm most likely to miss. So I tend to put the evening one together with any injection I've got to have before I go to bed on my pillow or next to my bed each day. The other thing about this is that you must always carry this with you, particularly if you're going away anywhere on holiday. Don't pack your medication in with your main luggage. Always carry it with your hand baggage. I say that from bitter experience. We were on holiday in Portugal, and we had, on the very first day of the holiday, our car got broken into. They took all our luggage, which included all my medication. We then had a very difficult time for the whole of the next day trying to obtain medication from a local hospital where the generic names were completely different than they are in the UK. The other thing about this is that you've always got to think ahead. If you're going to go away on holiday, you've got to make sure that you've got enough supplies well in advance, and you have to get a prescription from your doctor or from your pharmacy that allows for the time that you're going to be away. You've probably already seen the video that was made by Margaret, who's the senior sister in charge of the endocrine team at Christie. And she told you about how you also need to carry an emergency pack of hydrocortisone with you if you're on hydrocortisone treatment. Well, I do that. In fact, what I have done is I keep mine in an old spectacles case, because that way it keeps it safe, it's all in one place and it's protected. And in there I've got the hydrocortisone and the sterile saline solution and the needles. And on the front of it I've got a little note which says, this hydrocortisone injection is to be given in the event of any injury or severe infection. And that I carry with me again, always. One of the things that we do quite a lot, my wife and I, as we go out walking, we do a lot of walking. I always make sure I've got that either in my pocket or in my rucksack or somewhere about my person, because you never know when you may need it. The other thing that Margaret mentioned when she was telling you about hydrocortisone was that you will have to carry a steroid card with you. When you're discharged from hospital, they will give you a little blue card with all the information. Right from the start, I was quite worried about carrying this card because you obviously keep it, well, in my case, in my wallet. But I thought to myself, well, what happens if I am mugged and lying unconscious and they've taken my wallet? Also, I do quite a bit of sailing and I don't carry my wallet out on the water when I go sailing. And that is the sort of situation where I might need treatment. So what I have done, I have bought a necklace, and you can get these almost anywhere online. There's plenty of companies that supply them. It's a medical necklace, or it's a medical necklace. On the front it's got my name and my home telephone number. And on the back it's got my condition, hyperpituitarism. It's got the Christie Hospital. It tells you the treatments I'm on, steroids and thyroxine. It's got the telephone number of the Christie Hospital. It's got my patient number, and it's got the name of my consultant, professor, trainer, and the telephone number. So I now know that if anything happens to me, one of the first things that anybody will find about my person, hopefully, will be this. And I feel much safer in doing that. So the reality is that, yes, taking steroids and taking medication is life-changing. But it needn't be frightening and it needn't be threatening. It's just about changing the way you do things. Now, you are experiencing this perhaps for the first time. What I can tell you is that I had a first diagnosis of a pituitary tumour and had subsequent surgery nearly 20 years ago. So I have had 20 years of experience of living with this. And what is absolutely fantastic is the treatment that I've had, the support I've had from the endocrine team. I now only go back once every year for blood tests and checkups and consultation. And I now have an MRI scan every 4 years just to check there's no more growth in the tumour area. And right now I can tell you I'm just coming up for 67 years of age, and I feel as fit and well as I've ever done in the last 20 years. And okay, I've had moments, ups and downs. You've got to remember to take your treatment when you need it. One last thing. If you are going to have any other sort of medical intervention, whether it be operation for anything else unrelated to your endocrine system, or perhaps if you're going for some extensive dental work, you must always remember to tell the surgeon or the dentist or the doctor who's responsible about your treatment and the fact you're on steroids. Recently I had to have investigation which involved an endoscopy. I discussed the fact that I was on steroids with the consultant, and they decided to give me an additional 100 milligrams of hydrocortisone before they went through the procedure. And those are the sort of things that it's not down to the endocrine team to remember, it's down to you to remember. And if you can do, you'll find life becomes a lot easier, and you'll be, hopefully, as well as I feel, 20 years down the track. Thank you.